Today I'd like to talk about intestinal parasites and some symptoms. The symptoms of intestinal parasites are many and varied, since there are so many species that have the ability to inhabit our digestive tract. These harmful organisms may be microscopic or visible, and they feed off the nutrients contained within the colon and intestinal lining. Some typical invaders include Giardia, Toxoplasma, Cyclospora, tapeworms, roundworms, E. coli, and more. Giardia, a protozoan, enters the body through water that is contaminated with feces. It interferes with the digestion of lipids, preventing fat-soluble nutrients from being absorbed. Some symptoms of Giardia infection include severe diarrhea, bloating, greasy bowel movements, and dehydration. Toxoplasma, a single-celled organism, causes a condition known as toxoplasmosis. It enters the body through contaminated meat and may cause headaches, sore throat, and blurred vision. Cyclospora, another protozoan parasite, is transmitted through contaminated food and water. Some symptoms include muscle aches, fatigue, vomiting, weight loss, and stomach pain. Tapeworms are well-known parasites that are quite large. They are transmitted through undercooked meat and attach themselves to the walls of the intestines. Symptoms include nausea, severe changes in appetite, and cramping in the lower abdominal area. Left untreated, they may cause diseases such as alveolar hydatid disease. Roundworms, such as pinworms and hookworms, lay eggs around the anus, which causes itching. From there, they are spread through clothing, bed sheets, and through hands. Some symptoms are bloody stools, fatigue, and insomnia. If they aren't treated, hookworms can cause heart problems. E. coli, another protozoan, enters the body through contaminated water and undercooked ground beef. It secretes toxic waste, causing your intestinal tract to become inflamed. Symptoms include bloody diarrhea, vomiting, and abdominal cramps. You may experience any of these symptoms that have been mentioned, and it's possible that they are associated with other conditions. However, experiencing as many as 4 to 7 of these conditions at the same time indicates that you may in fact have harmful organisms in your system. If so, I recommend that you use a natural harmful organism cleansing supplement to remove them from your body. And I recommend everybody do a harmful organism cleanse at least 2 times a year. For more great health advice on healthy living and organic choices, please visit us at globalhealingcenter.com.
Hookworms are blood-sucking intestinal parasites that have jagged teeth they use to hook onto the flesh.
There are many types of hookworms, each specialized for a different host. But if Missy has contracted a human hookworm, she could be in danger. When a human hookworm infects the skin, the worm excretes an enzyme that breaks apart skin cells, allowing it to burrow freely through thick layers of skin. From there, the worm enters the bloodstream and travels through the body to the intestine, where it hooks into intestinal tissue and gorges itself on blood. But if a hookworm reaches the vital organs, such as the heart or the lungs, it can cause severe anemia, malnutrition, and even heart failure.
Some species of hookworms specialize on human hosts. Others feed on mammals like dogs or cats.
But it's not unknown for a cat hookworm to infect a human host. When a mammal, such as a cat, steps on soil contaminated with hookworm larvae, the parasites burrow into the cat through its feet. From there, they migrate through the cat's body, latching onto the small intestine, where they feed on blood. The parasite's eggs are passed in the cat's feces and deposited into the soil, where they hatch into larvae. When an uninfected cat walks on contaminated soil, the life cycle continues. There are up to 30,000 cases of hookworm infection in the U.S. each year. And even the cleanest domestic animals can carry the parasite. The best way to avoid contracting hookworm is to avoid walking barefoot on contaminated soil and ensure domestic pets are dewormed regularly by a veterinarian.
Hookworm infection is one of the most widespread parasitic diseases in the world. It affects an estimated 1.5 billion people worldwide.
Here we see a colonoscopy in a 54-year-old patient from Sicily. We just performed polypectomy, and now we see this unexpected guest dancing on the post-polypectomy wound ground. This very vivid white, small and delicate worm is an Enterobius vermicularis, or so-called pinworm. It is the most common intestinal parasite in the Western world and establishes itself mainly in the cecum and appendix. Normally, patients with this nematode infection have a high worm burden. Probably the worm burden in this patient was significantly reduced by the previous bowel preparation.